pretty full agenda today, and today is the day that we are looking at legislation that will come out of the Kupuna Caucus. So welcome, I'm Sharon Moore.
I still on one. Oh, okay. Well, let me know. No? No, my phone. Yeah, right there.
Okay, apologies, I got cut off. Okay, aloha again. I'm Sharon Mori, walking here, and I don't know if Representative Hashimoto is on, but Troy Hashimoto is also co-chair from the House. So welcome. Today we've got a full agenda, and we're going to go through some of the proposals that have been sent to us, and you also got a copy of all the proposals that we will be looking at before the meeting is over for you to vote on. So I want to welcome you all, and I see Representative Martin and Senator Misalucha, and let's see who else is there. Okay, so the first. So I'm calling the meeting to order. And the first item is John McDermott on the long-term care ombudsman update. So do I see John? John, oh, there he is. Hey, John, the floor is yours. Hello.
So are you able to hear me?
Yes, very well.
Okay, thank you for this opportunity. I sent to Heather two attachments, the presentation that I'm going to give, but also PowerPoint, which is a little bit more in depth, because I was told try to keep this to 15 minutes. And so I timed this and it's 8 minutes. I hope I can keep it to 8. Okay, so anyway, I became the state long-term care ombudsman on August 5th, 1998. And I'm not the state ombudsman, that's Robin Matsunaga. So he has a much larger staff and a bigger budget, and people do sometimes confuse the two of us. And they look at his website and they think I'm trying to pull a fast one when I'm always begging for money and staff. But we are two totally different programs with two different missions. The long-term care ombudsman program actually has right now a staff of one, me, with a volunteer coordinator, Lindy Itani, who's also present. And that's it. We have to cover the entire state, 6 islands, 1,779 facilities, 12,895 beds. We do have volunteers, thank God, and we can always use more. And we have 4 part-time ombudsman contractors. So again, thank God, and thank the legislature who provided the funding for that in 2017. But these folks can never really substitute for full-time permanent state workers. It's really an impossible task. I hope to retire sometime in 2023. So I or we are running out of time to make this a better program. How slow can you go? In 2017, the legislature approved funding to reestablish the Oahu Ombudsman. That position actually has existed from the beginning in 1979, but in 2015, a previous EOA director eliminated that position and also moved my volunteer coordinator to a new office, leaving me alone. Luckily, Lynn and I work very well together. But 2017, the legislature strongly supported correcting this mistake. And then we had to wait and wait for the Department of Health to approve a new job description, which, as I said, is not really a new job, and do their classification process and whatever else they do. And so that position wasn't posted until October last month, October 26, 2021, 4 years later. This is really shameful. So doing the math, even if this bill passes, it wouldn't go into effect until July of 2022, assuming that the governor approves. And then DOH could drag this out again unless the governor gets involved and tells his Department of Health to put this on the fast track. And I'm assuming that the fast track for DOH would still take a year. So that takes us into July of 23. And I want to retire sometime after August of 23 when I'm finished 5 years in this job. So that's a very tight turnaround. And obviously, I would consider staying on for maybe another year to train those people if we get those positions. So what happens to the long-term care ombudsman program when I leave if there is no staff to replace me? I understand no one is irreplaceable, and that is why I'm trying to get everything in place before I go. I've been asking for these positions for 23 years now. So our Kupuna Caucus will actually pass that committee, but then COVID hit and any bills requesting money died a tragic death. Our state has many wonderful programs providing support services to our Kupuna to keep them at home. But once they can no longer live at home and end up in a long-term care facility, the money and support seems to disappear. You're now on your own. The seniors that I work for seem to be the forgotten ones, and they are certainly the most vulnerable. They have lost everything, and now they must rely on strangers to provide their most basic needs, like going to the bathroom or eating or bathing. Some of them have outlived their families. Some of the families live on another island or on the mainland. And some, due to COVID, have been prevented from even seeing their families. So if there was ever a time for more ombudsmen, it's now. The National Institute on Medicine wrote in 1995 that the long-term care ombudsman program needs at a minimum 1 full-time staff ombudsman for every 2,000 residents. Hawaii has only me. Doesn't that bother you? 1 paid ombudsman for almost 13,000 residents. That should upset you. We are the worst staffed program in the country. Hawaii, a place which claims to love and cherish our Kupuna. Also important to note, when the recommendation was made by the Institute on Medicine, it didn't take into consideration the logistics of 6 islands I have to fly to, car rental costs, wasting time in the airport, etc. And in 1995, there were no care homes or foster homes or assisted living facilities. So there's lots more traveling today. I would much rather visit 1 halinani with 288 beds than 58 care homes with 5 beds. But the job requires that I do both. And the actual requirement by our Federal Administration for Community Living is that all residents must be provided with, at a minimum, a quarterly visit. So in Hawaii, that means that I should be visiting 30 facilities a day, every day. Long-term care facilities have dramatically changed. Warehousing folks is no longer acceptable or legal. Other issues, our residents have many more behavioral issues because of increased dementia. We have more younger folks in facilities with disabilities. We have more homeless residents, and the baby boomers are coming quickly, and we are not ready for the silver tsunami. The long-term care ombudsman program began as a demonstration project in 1975. It clearly demonstrated a need for advocates in long-term care settings. It became a federal mandate in 78 and a state mandate in 79. So that means that Kauai has waited 42 years for their own ombudsman. Molokai, Lanai, Maui have waited 42 years for their own ombudsman. And Hilo and Kona have waited 42 years for their own ombudsman. This is not the state of Honolulu. We have ignored our ohana on the neighbor islands for far too long. It's not right, and it really has to be corrected now. I'm grateful that the Executive Office on Aging has asked for 2 full-time permanent positions, but it is not enough. The state needs 5 positions, and the clock is ticking. I recognize that EOA is attached to the Department of Health and is in the difficult position of having me kick this dead horse year after year, while DOH has the final say on what EOA can ask for. So I appreciate that my boss is walking a tightrope. It's a very awkward situation. The solution, of course, would be for Governor Ige to step in and save the day. When then Senator Ige was running for governor, he called and asked me to meet with him to talk about senior issues. I went to his office and was impressed that he takes his own notes He listened very attentively. He seemed very interested in protecting our kupuna. He has attended most of Pavia's older American luncheons and often brought his wife. And he spoke of his strong interest in protecting our kupuna. I know he has also had a relative in a long-term care facility. So I really thought that he would be my hero when he became governor, but since that meeting, he's never reached out to me again. I know the Kupuna Caucus has always supported this program, and I am grateful. So Governor Ige, if you are listening, this is your last chance to introduce legislation and basically my last year as well. So let's both work together to make this bill a lasting legacy. One full-time permanent ombudsman for Kauai, one more for Oahu, since it has more than 10,000 residents, one for Maui, which includes 3 islands, and one for Hawaii, the big island, which has the most territory to cover. This will bring us up to a recommendation going back to 1995, 26 years late, but better late than never. Don't make our neighbor island, Kupuna, wait another 42 years. Mahalo.
Thanks, John. Are there any questions for John? John, just for clarification, you have your position and one more position for Oahu, and you're asking, I mean, if you had everybody being covered for the neighbor islands, is that 3 more positions, one for Kauai, one?
I have one Oahu position that was just posted, so that has not been filled yet. But because Oahu has a caseload of 10,000, I really want one more. So one for Kauai, one for Maui, one for the Hilo side, one for the Kona side. So that's 5. The Big Island, actually, we're not going to divide it up Hilo side, Kona side, because that's not where the facilities, they're not evenly divided like that. So the bulk of the Big Island is really the Hilo area. So the Kona ombudsman would basically cover the whole Kona side and probably the Kohala Hamakua area. So we need to count the facilities to try to make that as fair as possible. And we also are reimbursing our people for gas mileage, which we never did before. But because we did get $100,000 from the CARES Act, we were able to use that to finally pay our volunteers and our contractors for gas and many other things that we've never had an opportunity to do. And the PowerPoint presentation that I've asked Heather to send to all of you will explain in more detail what's going on. But for the sake of time, I thought this was going to be shorter.
So your position is okay, and one Oahu position, that's what you have now?
We have, right.
And then, so you're asking for 5 additional in addition to the 2?
Right.
That currently exist.
So EUA has already gotten approval from the governor's office for those 2, which again, very grateful. But that's really not enough because again, I'm retiring and I want to be able to train these people. I was lucky. I had 9 years working at Maunalani and Halinani, so I know their side of, long-term care. And of course, now there's another side to the story. And so, if you get somebody applying for the position who really has no background at all, there's a pretty steep learning curve to do this job. And so I just want to make sure that our seniors are protected when I'm gone.
Thank you. Any other questions? I think it's really an important program because they have no voice and the long-term care ombudsman is their voice. So, having someone that they can trust to call on, especially when you're in a nursing home and at the behest of the provider. So, I think we'd like to support whatever we can to make you whole after, 25 years? 45 years. So any other questions of John while we have him? Questions, anyone? Something in chat. Hold on one second. Okay, it's all accolades to John. No questions.
Well, I would ask one. I would say, John, so what has happened in all these past years? Where does it? This is Rick Tabor, by the way. Where does this fall apart generally, John?
You know, the legislature, as I said, and in particular the Kupuna Caucus, has always been very supportive.
Yeah.
But even when things pass, when it comes to the dollars, that's when it disappears. And as I said, just before COVID hit, we were the closest ever in getting all the 5 positions. And even with the contracted positions that we got in 2017, I hadn't even considered about operating costs. And so Representative Sylvia Luke, who was chair of House Finance, you know, she jumped in and she said, you're not even considering how to run this program. You need some more money. She threw in an extra, I think, $6,000 or $7,000. So strong support from the Kupuna Caucus and from legislators. I mean, we all have parents, aunties, uncles. None of us think we're ever going to go into a long-term care facility, but you know, to quote Gomer Pyle, surprise, 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 it happens. And if your family lives on another island and that's your protector, they're not there. And so you're going to hope that there's an ombudsman assigned to your facility who comes on a weekly basis and says, how are things? Do you feel safe here? Is anybody bothering you? You know, we think because we're the Aloha State, we don't have any problems. And unfortunately, that's not really the case.
Okay. Thank you. Thank you for your service, John. Stick around so that you.
Senator Moriwaki?
Yes.
Sorry, this is Kelly. I'm not
Kelly.
sure. I presume you're
Oh, yeah, please proceed.
assuming you wanted questions from the other legislators, but I guess my question, John, is what's the funding mechanism for the positions? Because, you know, when we were at the Department of Commerce, when I was at the Department of Commerce Consumer Affairs, the licensing fees of those that were regulated was used to fund the oversight aspects. And is that not an option with regards to having some of the licensing fees that are collected from these folks be used specifically to fund ombudsmen? Has that been looked at before? And legislators, is that a consideration? I think you've got to find a dedicated way for these positions to be funded.
Yeah, you're correct. There are some states that use licensing fees to support the ombudsman program. So that is something that maybe the legislature could consider. I really don't know how much money is generated from those licensing fees. I'm sure Keith Ridley would know the answer to that. If the building back better, I don't know if I'm saying that right, but supposedly there is some federal funding that might also be heading towards the ombudsman programs across the country. That, of course, just recently, I think today, passed the House, has to pass the Senate. Yeah, so we definitely want to get these positions in place. Again, my experience in this job is that I think that the legislature does have a tendency to be Honolulu-centric, and that the neighbor island folks are often forgotten. And again, if I go to a neighbor island, I have to now be at that airport an hour and a half before. You're wasting a lot of time with all these COVID situations. Okay, so there and back, that's 3 hours wasted. I'm supposed to work for 8 hours, so I just wasted 3, so 5 hours. You're only going to see maybe 2 facilities when you're on a neighbor island. Somebody who lives there, they can see an awful lot more. They can follow up on investigations. They can go to family councils, resident councils. They can talk to the local city council members, the mayor's office. They're local. They know the local people. They know how to recruit for volunteers. You know, I'm a haole originally from the mainland, and even though I've lived here since 1985 and know how to say kama'aina, there are still some people who have doubts about me. So I really want local people working with their own local communities.
Yeah, thanks, Kelly. We did talk to Keith a couple of years ago about how we could support the ombudsman, and it didn't seem that it was possible, but we can circle back and see where the licensing fees go. and see whether we can get a corner of that market. And the federal funds are okay, but they're not sustainable. So I think state funds and perhaps what you're suggesting, some kind of fund that's there, like licensing, if a percentage of that could come to the ombudsman, that might be another way to look at it. And we can certainly look at it and talk about that. I see Representative Hashimoto is on now, and so is Representative Takayama. So if we can work on something to at least follow up on that. Thank you. So any other questions for John? Okay. Okay, moving on to the Retirement Savings Task Force, Audrey Suga Nakagawa.
Yes, good afternoon, Senator. Yeah, so what I'm going to be doing this afternoon is just giving you a brief update on the work of the Retirement Savings Task Force. So I have a short presentation. It will be really short. So if bear with me, let me share my screen.
After this one, yeah, after this one. Tell her it's after this one since I already started them. Okay. Oh, 3 o'clock. Yeah, 3 o'clock.
Okay, can everyone see my screen? Okay, so what I want to talk about just is an update of the work that the task force is doing. And just for background, the Hawaii Retirement Savings Task Force was established this past legislation by the Senate Resolution 76. And the job of the task was to look at the feasibility of establishing a state facilitated retirement savings program for the private sector workers who don't have an easy access to a retirement savings plan through their employers. We know that there's over 216,000 workers who work for small mom and pop, small retails, auto shops, salons, and so they don't have necessarily, their employers do not provide with them with like our 401k plan that they could participate in and contribute to towards building their retirement. And so we know that people can go on their own. They can go and open up an IRA account at the banks, but most people don't do that. And studies have shown that 15 times more people would likely be contributing to their retirement savings program if it could be done through their employer. And if it's an automatic payroll deduction, even more so, it's much more effective. And because people are not saving enough, we're very concerned about our future retirees and whether or not they would be able to save enough and live on their savings. Living just on Social Security alone would just not cut it, especially in this very costly state. And so this is what the task force was looking at, the feasibilities of having something that could be provided to this segment of the workforce. So this task force had looked at 2 models, and throughout they have been working since August, having regular meetings, listening for testimony, getting information from the experts and from the other states that have established a similar program, and see what would be feasible for Hawaii. And there were 2 models that jumped out. One was the auto IRA. And this is a public-private partnership in which you create a low-cost, easy retirement savings program that helps all employers automatically set money aside out of their regular paycheck. So this is a program that the employers can all participate in, sign up their employees, and then the employees will elect how much, if they want to participate or not, it's up to them. And then they would put a percentage. So it's a very simple, straightforward format. The second model is called the marketplace model. And what this is, it creates an online marketplace. So basically it's like a menu, a website with a menu of different retirement savings products in which the employers can select one for their company and then have their employees participate in that particular plan. The auto IRA model seems to have a much more proven track record of success. It's very popular, and 3 states went out first on this one. Oregon Saves went out in 2017, followed by California and Illinois. And to date, this is how many people have participated in this particular model. 38,000 employers has signed up their companies. There's over 400,000 individual funds. So their employees have opened up their own accounts through this program. And to date, they have amassed over $333 million in funds. There are other states that are already rolling into this program as well. So we know that Colorado, Pennsylvania, Virginia, New Mexico is all going to opt for this particular model. The other model, the marketplace model, only one state is participating and using this particular program. And as you can see, it doesn't have a high usage. To date, Washington rolled this out in 2018, and to date, only 16 employers has signed up their company to participate. And in addition to that, only 23 individual funds were open. So they amassed only $1.3 million. The task force had done several studies looking at what are the interests and concerns from our constituents in Hawaii. And so two different surveys were conducted recently in September, in fact, September, October. And this was the response that we got. So there was one survey that polled the small business owners, and there was one survey that looked at the workforce between the age of 18 to 64, and wanted to see, what would you do? Would you support a public-private partnership? And as you can see, the interest was very high. They acknowledged that the retirement saving was a very important issue for them. Many felt that they were not saving enough for their own retirement. And employers, we thought, well, with the pandemic and their focus on trying to recover their businesses, perhaps may not see retirement saving as a high priority item. But surprisingly, the surveys say that they did. They thought that this was very important for their workforce. They also felt that it would be a great benefit and provide some competitive edge in recruiting and retaining their employees. And so you can see that there is a strong support, even with the pandemic and the economic shutdown, towards something that would be facilitated by the state. The task force is right now in the midst of finalizing their report and putting in their recommendations. They hope to have it submitted to the legislature on December 10th. And so that's where they are at right now. Are there any questions? Oh, and so are there any questions?
Questions, members? I don't see any.
John has one.
Oh, John.
Yeah, so I'm wondering, Audrey, for people who already are saving, can they opt out of this, or is okay? And then, I'm a state worker, so I know that our pension fund sometimes goes up and down based on the stock market, and I assume that they are the experts. I'm not an expert, so. Will people get upset if they do this and their retirement savings starts to spiral downward because, the economy, people are thinking that, okay, this is like a sure bet that you're going to make sure that I'm in good shape when I retire. And are you able to make that kind of a guarantee?
No.
Yeah.
No, so just to keep in mind, the state's role in this, in a state private public partnership, the state will set up the framework for this particular program, but then they will then procure a private financial program administrator, someone who knows how to do the investments or will select the products for the investments, and they will manage it. So it would be no different from if you were to go and get your own IRA through the banks, so whatever the market, however prevails, if that's how it's going to work. So the state does not provide any type of guarantees, nor would any financial plan would provide you any type of guarantees.
So Audrey, I see Senator Joy Buenaventura joined us, and her question is, did you look at did the task force look at the Georgetown study on state facilitated retirement savings programs? And is that part of what you folks researched in your task force?
Yeah, so we have Pew Charitable Trust providing a lot of the background information and research, and they did and look at the Georgetown study. So this has been all part of the whole process of and then they summarized the information and they were giving it to the task force. And so basically what I have described to you about the IRA programs and the marketplace program also is reflected in the Georgetown studies.
Okay, any other questions? Okay, seeing none, we will move along. I'm going to take one request out of order. It's Senator Bennett Misalucha has a bill that proposal that she'd like to talk with us about. It's in the list of proposals that we'll be looking at later on, but she has a hard stop at 3 and she requested, if that's okay with everybody, to have her spend a little time talking about her proposal. I see any objections?
Is that okay? Sorry, folks.
Okay.
Thank you. And I know you're all busy. So thank you, Chair, for taking the request. So this is, and I know you would be considering several proposed legislation this afternoon, but this is something that the Kupunas in our district have been clamoring. And so last year we proposed legislation where the folks who are from 70 to 80 years old, 72 to 80 years old, right now, they have to renew their driver's licenses every 2 years. And I think it's a fact that a lot of 72-year-olds are, still very, youthful, and they feel that this is really imposing a hardship on them, particularly in view of the pandemic. So there has been a request to extend the period of renewals. So we've explored, so last year we introduced a measure that would extend that, and it's contingent on traffic violations. And I think similarly, Representative Takayama did introduce also a bill in the House. And in the case of the Senate bill, it got stuck in the judiciary. It passed the Transportation Committee, and then it got stuck at judiciary. And that's where it sat. Now, during the interim, we reach out to the Judiciary Chair, Senator Carl Rhodes, and tried to work with him on his particular objections to the bill. And I think we have a bill that now satisfies most of the proposed or the potential committees that will be handling this, or it will have to go through, and that includes transportation, even judiciary on the House side. So we've sent that out, and we were hoping you would consider this as part of the 5 proposed legislation that would be sponsored by the caucus. So the difference is that this year, it still extends it from 72 to 80, but rather than having a bifurcated route where those that want to, have an extension versus those that would continue to keep it at year 2, Senator Rhodes would like to actually have it so that it's everybody, all the Kupunas from 72 to 80 would have a 4-year period by which they can renew their licenses. However, they have to submit a doctor's certification about their mental state as well as their I think physical state. So then that way everybody will have to do this. So he said he's comfortable with this. I think we're still navigating some potential issues, because what if, the doctors, for instance, they might balk at this because of the potential that they might, heaven forbid, there's an accident that they might be, sued or be liable for that, for their certification. So that's the one where we're still trying to finesse it. The judiciary staff has been working with us on that. But I think if we're able to pass this legislation, it would be a really impactful, piece of measure, because it will affect a lot of our kupunas who are in this, predicament that, it really, I think it's taking, a lot of their time and energy and effort to be able to renew their licenses. So that's where it's at. So any questions that you may have, please let me know. I don't know whether this is the proper forum, because right now I know you have another agenda, but I just wanted to put that forth as a proposal. And again, I'm sure we're going to be. I think we've submitted the measure, or the proposed measure, to SMA. We have something in place already as a draft, but we'd be happy to provide you with that copy should you want it or would like to know more about it.
Thank you. Any questions of Senator Misalucha? I do have one. Who would be administering this? Because we get the driver's license from the county. So you're working with the counties as well, so that they're the ones who have to, I guess.
Yes, correct.
Okay. Any questions? Okay, thank you.
But I'll still hang around. But
Okay.
I just have a hard stop at 3.
Okay.
Thanks.
All right. So let's go back to our agenda on the broadband roadmap. Kyla Carlisle from Hawaii Public Health Institute. I see her on.
Hello.
Kyla,
I will keep this short, as I know there's a very full agenda. Let me go ahead and share my screen. Okay. All right, and I will go ahead and get started. Thank you for having me here. My name is Kayla Carlisle. I am the Outreach and Engagement Specialist for the Hawaii Public Health Institute. I'm really excited to be here to share an update about our progress on the Kupuna Digital Inclusion Project in conjunction with AARP. So there are 2 project elements. We are working on a digital inclusion roadmap, which is going to be a statewide blueprint of sorts that identifies the current broadband access and resources for Kupuna, as well as highlights digital gaps and disparities, and proposes future program initiatives that will help improve the access and use of digital technology for our older adults statewide. The other portion of this project is a digital resource directory that will be a compilation of resources for Kupuna statewide who need assistance getting online, whether that is finding a training to learn how to use a computer, whether it's financial assistance for paying for internet services, or whether it's for finding specific tutorials online. Those will all be included in the digital resource directory. So first, I'm going to talk a little bit about the roadmap and just about some of the findings that we have so far. I have here the percentage of adults in Hawaii with a computer and broadband internet subscription at home. For adults between 18 and 64 years old, that percentage is 88.3%, versus for adults older than 65 years old, that percentage drops down to 73.3%. And that comes from US Census Bureau data. And we looked at both national and local data, and all of that will be included in the roadmap. Furthermore, we found that there are several disparities across or within Kupuna themselves, specifically geography. We found that when we're looking at the percentage of older adults who do not have a computer at home, don't have access to a computer, that percentage is much higher in Hawaii County as compared to the city and county of Honolulu. And so we noticed that there's some inequities and some disparities that exist between islands, as well as between genders, between ethnicities, between different educational attainments. And so to address this, we are hosting listening sessions with Kupuna across the state. And in order to develop a more nuanced understanding of what their experiences have been like, both accessing the internet as well as obtaining and using technology. So I have here on the screen just a few quotes that we pulled from seniors that we've talked to. In the interest of time, I'm not going to read them, but I will distribute this PowerPoint in case you want to read on. I will go ahead though and share some of our key takeaways. There are a lot of barriers to entry for Kupuna across the state. We've found that there's a lot of internalized ageism, the idea that once you hit a certain age, you can't learn new skills, or that the internet is not meant for older adults, as well as other misconceptions about getting online. We're also finding that many Kupuna face inadequate access to broadband internet, especially on our neighbor islands. We've been hearing from a lot of Hawaii County folks that even though they want to get online, they have a really difficult time just because it's very difficult for them to get reliable, fast internet. On top of this, we're hearing a lot about affordability. You know, when you're on a limited income, paying for something like internet services, which can be $90 to $100 a month, can feel like a luxury. So for a lot of people, the affordability of having a broadband internet service at home is not feasible. And lastly, a recurring theme that we're hearing is that people are really concerned about cyber safety. And so this is something that we think needs to be addressed widely in the trainings and outreach that we provide for our Kupuna in regards to getting online. We've also found, though, that there are a lot of enabling factors. We saw that although only 73% of Kupuna are online, that's a lot of people that are online. So we want to understand, you know, what are the factors that help people get online and use technology? And we're finding that when people have a support network, when they have friends and family who are accessible that can help them use these tools, they're more likely to try or to continue learning. Additionally, we found that there's a great motivation to stay socially connected. I know that we just talked a lot about how a lot of people don't have family right now that's on island or they're separated because of COVID. And so access to technology has become huge in terms of being able to communicate with loved ones. And that is the most commonly reported use of technology right now amongst the Kupuna we've talked to. And lastly, we've found that instructed classes and technical support have also been great enabling factors. We're seeing that a lot of senior centers are now offering technology classes, whether it be for iPhones and iPads or for basic computer skills, and that these classes are being widely taken advantage of and have really positive feedback. So this is something that we want to continue in the future, and as well as build off of the lessons learned and the feedback that Kupuna are providing for those classes. So the other part of this project is the digital resource directory. I've included here some examples of the type of opportunities that we are including in the resource directory. We're envisioning it to be like the EAD handbook. We want it to be really accessible and really usable for our Kupuna. We want to organize it in the most effective way possible. So we're including things like if you want to learn how to use a computer or a smartphone or a tablet, if you want to do that through a self-guided tutorial at home, or whether you'd like to go to an in-person instructed class. We're also including information about the financial assistance that's available for Kupuna who are struggling to pay for internet services, like the emergency broadband benefit, the lifeline benefit, Hawaii Telecom's low-income service, as well as Spectrum's low-income services. Lastly, for those who are struggling to afford a device itself, because internet access is not the only thing that's expensive, it's the actual computer or iPhone or tablet itself. We're including the opportunities that are available statewide for refurbished or discounted technology. And so we are seeking your input. If you know of opportunities like those for your community, we want to hear them. We want to make sure that this is as comprehensive and inclusive as possible, especially for neighbor islands. We're finding that a lot of these opportunities are on Oahu, and we want to make sure that we are inclusive of our neighbor island Kupuna as well. So if you know of any opportunities, I'm going to put this link in the chat if you could fill it out. Additionally, if your agency would like printed copies of the directory to distribute to Kupuna, that is also on that Google form so that you can request printed copies. If you have any questions or input, you can also email me. I'll put my email in the chat as well. Thank you, everybody. If anyone has questions.
Questions, members? Lei Lerma, unmute yourself, please.
Yeah. Just recently,
we're trying to get a safe travel Hawaii thing. And my partner did all the work on it. And he found out that you have to, aside from having an email account, you have to come up with a 10-digit password. You need to get a different browser to go back to the email to find the code number, something about a phone number. And they show the text on the smartphone, and then you have to scan it. And when government comes up with getting something, that you have to, if you're going to travel, and I'm going to be traveling in December, they make it almost impossible for someone like myself to comprehend all of these things. Like I can do a lot of computer stuff, but I don't do scanning, so I'd have to learn how to do that. And so it'd be nice if the different departments with the government would make sure they're user-friendly. Because if I'm having problems, I can imagine the other kupunas.
Thank you for providing that feedback. Definitely that recommendation is something that we'd like to include as accessibility as a whole. And like you just mentioned for yourself, someone who's Zoom capable and someone who knows how to do a lot of things, but is still struggling with something as simple as registering to travel, you can only imagine how difficult it is for other folks. And so right now we're developing our list of recommendations for programs and policies for 2022. And so thank you for that feedback. We will definitely think of a way to make that a part of our list of recommendations. Is how can we better collaborate with our governmental agencies to make sure that not only things like this, but also a lot of public assistance registrations are going online now too, which is difficult for a lot of people. Not everyone has email, like you mentioned. So that's definitely something we are considering, and it's a very, very important topic. So thank you for bringing that up.
Thank you.
If I could just add one thing, Senator Moriwaki, this is Kaylee. The reason why this work became so important to ARP and a lot of folks that are actually here today is what we saw as a significant challenge during the pandemic, and especially when it came to Kupuna having to initially only could register for vaccinations via the internet. And that was clearly a challenge for many Kupuna to get online, to sign up for registration. Many of them didn't have an email address to which a confirmation could be emailed to. And so a lot of the organizations here online definitely have experienced the challenges for Kupuna having to get just normal services. And in this case, life-saving services as it relates to vaccinations. And that's why, again, ARP, but again, a lot of partners here that I see, the faces of many wonderful folks. This is an important initiative. So just wanted to add to that why it's really such a paramount concern for us.
So Kelly, just a question then. So organizations would help, and I know that Kayla's talking about educating, but some may have problems even trying to use the computer. So what has AARP done, or is it being the intermediary, or is it getting something in writing, or?
One, I think Audrey would be great to be able to tell you. So the digital inclusion roadmap really is to help Hawaii, especially legislators, know what's already available, what are the gaps, so that these organizations who really actually have their boots on the ground and doing the training, many of the senior centers, as an example, do the training, the state library does training. We hope to have other groups that begin to provide training targeted specifically to Kupuna, and that they can use the digital inclusion roadmap as part of a way to in fact, access. So imagine it as just a study that they can use to go after additional funds, whether it's the Executive Office on Aging, the AAAs, individual nonprofit organizations, especially as the BBB, Build Back Better funds become available, but also already in the infrastructure legislation that passed. So there's going to be funding, and we're hoping that the guide is used for that. I mean, not the guide, the roadmap. And then the guide is a separate tool, which really is, as Kayla indicated, it's very similar to what the AAAs put out right now, which is just a resource guide for Kupuna and their family members. to find out where they can go to get information, where they can go to get help. That's what the two different pieces are. And of course, if we can, ARP will engage in some of that training, but there's a lot of folks out there already doing a really good job, and we just want to make sure Kupuna can get connected with them. And Kayla, if I missed, or Audrey, if I messed anything up, let chime on in.
Okay, great. Anything else? Any other questions for Kayla? Okay, we're going to move along then to the main part of our program today, the legislative proposals. We have a number of proposals that you sent in, and then I put together through Charles the list of them that all of you should have right here. And I'm going to read through each of them, and if anyone is here on these, please raise your hand or speak up, and we can have you, as Senator Misalucha did, tell us, do your pitch. So amend our care, our choice, amend our care, our choice act. And this authorizes the APRNs, in addition to physicians, to practice medical aid in dying in accordance with scope and practice and prescribing authority. Is anyone here, Rick?
Yeah, I can speak to that. So Compassion and Choice asked me, they put a little something together. I'm gonna abbreviate it though, because we're pretty close to running out of time here. So the Our Care, Our Choice, as you know, went into effect January 1st, 2019. And it's been, for those that needed it, it's been good, but there has been problems. So the problem are folks that are residents of like Hawaii or more rural areas have a hard time accessing docs that can authorize. We need 2 doctors to authorize this bill to be put into effect. So basically they have to have 6 months left to live. They have to be competent, and they have to be able to take the medication on their own. They have to get 2 docs and one psychiatrist or 1 psychologist to authorize it. And then once that happens, there's a 20-day wait period. So there's 15 steps. 1 out of 5 are actually passing away before they can complete those steps. And they don't die peacefully. So it hasn't been good. We have a lot of testimony to what happens. So it's been recommended, and many states have gone to this already, to loosen up and have the APRNs be one of the authorization. Be it a medical doctor could still be one of them, and then an APRN who already are authorized to do Schedule II medications. They're already trained to do this stuff. We tried to do this last year, passed in the Senate 24-1, and then it was held up in the House. So we also want to loosen up the 20-day. We want to give the authorizations, the people authorizing this, the ability to free up the 20 days so a person can actually take the medication sooner, or access the medication if they want to. I got to know, a lot of people that even get the medication don't take the medication. It's just a peace of mind kind of thing. But those that want to take it, we'd like to help them to be able to do this a little bit easier. So that's basically it. They'd like to reduce the mandatory minimum 20-day period to 15 days like other authorized states have. Some have actually gone to a 48-hour wait period. California just passed that earlier this summer, that bill. That's it. So that's what we're going to try to do this year. I really abbreviated what they sent me. If you have questions, happy to answer them.
Great. All right. Thanks, Rick. This is the one we've already discussed, but it's merge Kupuna Care and Kupuna Caregivers. Caroline, you want to say anything?
Nothing more. I know I've presented on this, and also that is a legislative proposal through the governor's office. The only thing I do want to add, though, since we're looking at the list right now, is that we don't see our state health insurance assistance program on the list. And we sent our request in on November, well, not our request, it came from Dr. Victoria Fan on November 2nd.
Oh, sorry.
Send it.
Okay, yeah, please do. And what is that one? Can you just give us
our state health insurance assistance program? So we're looking to get state funding to support that program so that we can continue to provide the counseling and plan comparisons for those going on to Medicare at age 65. I know Dr. Fan is on, and I'm not sure if she'd like to say anything.
Dr. Fan, you want to say anything? So what is the budget on this? Is there a proposed budget amount?
I don't have it right in front of me. I think it was either 275, 300,000, I believe. Hold on. I will get that for you, Senator.
Okay, get that to us so that we can add this on the list. So
Right. Okay, be happy to.
Okay. So then we heard from John on the LTCO. John, you wanted 5 positions, but there's what, a request in the governor's office and an admin package is for 2 additional positions, or is it 3 additional?
The Executive Office on Aging put in for 2. I need a total of 5.
Okay.
Yeah.
Okay, so that's a question we'll have. Shall we go for 2 or shall we go for 5? And that will be on the list. Get through the gate, and then we can say whether it's 2 or 5. Okay. All right. So the next is you heard from Senator Misalucha on the driver's license extension from 2 to 4 years with conditions. The next one is Fund the Hawaii Healthy Aging Partnership. Who is someone here for that? I saw Peggy. Peggy, is that yours? No? Yes?
It's from Michio Tomioka.
Okay, who's there to speak on it?
Michio Tomioka.
Oh, Michio. Okay.
Tomioka.
Okay.
I'm from Center on the Family.
Okay.
And I coordinate and evaluate Healthy Aging Partnership. And I think most of you know about the program. And we have been very fortunate to have state appropriation every other year to sustain our efforts.
Mm-hmm.
And we offer 2 evidence-based programs to promote the health of older adults. But when the pandemic hits, all in-person classes and services were postponed. And at one of the Kupuna Caucus meeting, I presented the finding of COVID survey findings. A lot of seniors are negatively impacted by COVID, and, they lost the opportunity to exercise. So Healthy Aging Partnership, we adopted a virtual version of evidence-based health promotion exercise program. Enhanced Fitness, now we offer through virtually, and Better Choices, Better Health, which is a chronic disease self-management interactive workshop. We offer through the phone for not the tech savvy, and also virtually. And because it's evidence-based program, we see the same similar positive outcomes and similar cost saving. So we're hoping to get the funds because if we don't act now, after 5 years, maybe medical costs may go higher because more and more people may gonna fall, more and more people worsening chronic conditions. So we are really worried, and we want to prevent that happen to them. So
what is so Michio, what is the amount that you're
550?
Okay, and it's for one.
That's all goes to throughout the state. So from Kauai to Big Island.
The statewide.
Yes.
Okay.
And in 2 programs.
Okay. All right. So
Thank you.
Michio. Okay. Let's move on to the AARP has a number here, so I'm not sure how we're going to deal with it, but the retirement savings program seems like a biggie for them. Audrey, you want to address this because we have limitation of 5, so I don't know if we put.
Yes, I agree.
And
so we, like I had stated, we are still waiting for the task force to complete their final recommendation and submit the report to the legislature. So it's very likely that there will be a legislation. So until we see what that is, but if it does get introduced, we're definitely going to be supporting that. At this point, if the Kupuna Caucus can just support that, that would be really great. The other bills are affordable housing, telehealth. These are bills that we typically see every session, and ARP always has supported them. And so until we see what's going to get introduced, we just wanted to put some placeholders as to, these are some very important matters that we are focusing on. So what they are specifically, we do not know at this time, but just to let you know that this is the areas that ARP is definitely going to be putting a lot of energies into. So this is all why we just kind of gave a laundry list here.
Okay, great. So what we're going to do on this is that the seems like your high priority and that you have sort of more information on that we can actually see what you're planning to do is going to be on the polling sheet. And these other ones, since we are limited to 5,
right?
We're going to just put that aside, and as it comes up when we meet along the way, and there's more information once the bills are introduced, then we can look at that. And well, not part of the package, they certainly can be supported by others on the member. Is that okay?
Sure.
Okay. So we're going to just take off the rest of it and do the retirement savings, which is what you presented. So if people are voting on that, kind of refer to what the task force will come up, but you've got the concept behind what they're proposing.
So Senator, just for clarification,
yes.
And maybe it's a premature for me to ask this question. If this is included in the package, is the caucus going to be introducing this bills? Is that what you're saying, or is it just a package?
Right. I mean, so the co-chairs of the caucus are Representative Hashimoto and myself. We can introduce it, and if we see that it might be, well, we also get co-sponsors. So we would go around, say that if the Hawaii Retirement Savings seems to be like also the Committee on Consumer Protection would be very much involved. So we would try to get co-sponsors and when we introduce it, but it's how it gets drafted, who drafts it. If you have other senators or representatives that have worked on this, that would be the place to go, but it would be supported by the caucus. And I would say that when the things come from the caucus, our colleagues all support it because they know it's been vetted.
Right. Yeah. And again, it's a little premature for us to say this, but yeah, most likely because we do have 2 legislators that sit on the task force. It's likely that we would be hoping that they will.
So yeah, if you have them doing it, that's great, because that's the thing for us to do. But if in fact this comes up as one of the 5, then we would have the Kupuna Caucus write testimony in support of it, so that it is seen as something that has been vetted by our membership, and there's more support for it.
Got it. Okay, thank you. I just wanted clarification. Thank you on that.
Yeah. This one is housing. It's been brought to our attention that homeless and a number of those who are really vulnerable older adults that have ADL functioning problems don't have a place to go, so they're out on the street. So this comes out of, I'm working on a homeless and homelessness group, and this came out as a real big gap. And so I've talked with HPHA, Hawaii Public Housing Authority. They said, yes, we could have a set aside for these individuals, and perhaps we could get some funding for some case managers to make sure they take the medications and at least they have a place to live that's off the street. So I am going to introduce this bill, and this comes out of helping the really vulnerable and having a place for them to live and get support that they need. A lot of them don't remember to take medications and so forth. So yeah, so that's that bill. And then I've included Charles, the Hawaii State Health Insurance Assistance Program under the Center on Aging. So these are the ones that have come up to us for presentation to you. And now I just have, I want to honor everybody's time, but we're a little over time. But I just wanted to get an open forum if there's any other bills that you are working on or you feel are important for us to take forward next session, a few minutes Just throw it out there.
I just have one that I guess Senator and I have been working on, but it's not going to be in our package, but it's going to be in the Gov's package. But we do want to support Keith Ridley in his efforts for long-term care, trying to get our care homes licensed. He's having a severe issue trying to get those long-term care homes certified because he doesn't have enough staff. He has the money, but he doesn't have the staff. So he's just trying to raise his ceiling. So we are, I think we've been very supportive. I think this whole group, the Kupuna Caucus, should be supportive. As I said, it's not necessarily going to be a bill because he has the bill, but he needs the firepower because it's a huge issue in our community.
That's right. Thank you. Yeah, thanks, Troy. Thank you. Yes, because I think we've, through this caucus, we've been pushing him to have faster information coming back on the website or having reports as soon as they finish their inspections, but he really is understaffed, and as Representative Hashimoto says, he has funds. It's just that ceiling is so low. So we hope we can all support that as well. So, okay, so with that, anything else? Thanks, Troy, for bringing that up. So we have a list that now includes everything, and I'll just include that one so that we don't forget it. But it is an admin bill, so it does not need to be in the package, but just so we kind of follow it along, because I think that's really important. So we will now send, if we have all of your emails, we will send it out to you, and you can look at this and think about it some more, and send us your top 5 priorities, maybe 1, 2, 3, 4, 5, one for the top, so that we can then tally the votes on which is our top 5. And again, just to be clear, because the House is limited to 5 in the caucus, we will pick the top 5, but that's not to say that we should not support the others. It just won't be seen as the caucus package. So again, as you start ranking it, I think those that go to the top that we have consensus on, we will monitor that. And as we meet during the session, we will inform you. And other things come up like AARP, that bills come up that we should be looking at. I think that we could also do that during the session. Are there any questions? Okay, well, seeing none, I want to thank.
Well, if you don't mind, I'd like to just mention on Monday, 11:30 to 1 o'clock, Kupuna Council's going to do something a little different along this line. So we're going to have similar people presenting, but we're going to have all the legislators, senators and reps on board, and have more of an open discussion about the bills. And so everyone's invited to join us. And the easiest way to do that for you is to just go onto our Facebook. So Kupuna Council Facebook page and watch it from there. Okay. And just contact me if you need more help with that. So that's coming Monday, the 22nd, 11:30 to 1 o'clock. Thanks.
Okay, thank you, Rick. Thanks for all of you're doing at Kupuna Council. So, okay, so
I do have a question.
Announcements. Who's that?
Yeah, here, Sarah Yuan, Senator.
Sarah, yeah, Dr. Yuan. Yes.
I do want to ask a clarification on when do we will start to vote for these priorities. Will the time frame for this voting, or do we have other chance to discuss this again? And I also noticed that one of the UA's bill for combining the Kupuna Caucus and Kupuna Caregiver and Kupuna
Kupuna Caregivers, yeah.
So that is already in the governor's package. So bills like that, do we still vote for it, or do we want to focus on those that are not already in administrative package?
Yeah, I think you're right. I mean, if it's in the governor's package, it has a lot of weight. On the other hand, sometimes the governor's package, even if it's in the governor's package, doesn't always go through. So I don't know how to advise you other than vote priorities as you see important for the coming year that we should really support, because we are limited to 5, but we are not to limit ourselves to 5. So if all the members want to support I think it really is helpful to have testimony from individual organizations as well as the Kupuna Caucus.
All right, thank you.
So I'm going to have Charles send it out to everyone, and maybe we could give a deadline so that we know how we're going to go forward with drafting anything. So maybe by next week, how much time do you guys need? So maybe next week, Friday. Yes. Oh, Kathy. Yes, Kathy. Could you unmute, please?
Sure. Yeah, let's go back to the ombudsman thing. John said he needs 5 positions. That's what he's asking for. And then you said something about 2 positions. I got kind of confused with that because he needs 5.
So the governor's, this is one, Sarah. The governor's package will include 2. John wants 1 on the neighbor islands and 2 for Hilo and Oahu. So he's asking for 5. So would the Kupuna Caucus then say, we want to have the ombudsman, but he needs all this support on, especially the neighbor islands, and say, put in something for 5. I don't know, Caroline, you're the gatekeeper there. Do you want to make any statement about that? Is Caroline still on? Oh, I don't see her.
A 3 o'clock meeting.
She left.
Yeah.
Okay, so I mean, so we could do that. The pleasure of so what we'll do, here's what we'll do.
Can I make a comment?
Yeah,
Hello?
yeah. Okay, Representative Amani. Okay, yeah.
So if there is a discrepancy like that, since the administration is the one that even if we say 5, but they're only willing to fill 2, they're only going to go fill 2. So that would need to be worked out with the department to ensure that the number that we agree to would be released by the governor, right? So if we allot 5 and all salaries with fringe, that monies will be allocated for that. So, but it doesn't restrict the governor from only filling 2 positions. That means then those 3 positions and fringe is stuck. You can't use it for any other reason other than at the pleasure of the director at the end of the period. So
thank you.
So in order, if you want the 5, there's going to be some need to get some kind of commitment either by BNF or the govs that they're going to fill more than the 2 that they're asking for. Okay, thank you.
Thank you. Okay, so here's what we could do. Under that ombudsman, we'll put ombudsman 3 positions, and John, you can tell us how much the 5 position would cost. Ombudsman 2 positions, ombudsman 5 positions, and if in fact it rises to the top, that 5 positions, then let's see if Troy and I and others can go talk with the governor and see whether, or BNF to see whether that is possible. So let's leave it at that and see where it rises to and whether we need to follow up or not. Because there's a whole bunch of bills here. So, so
the PowerPoint that I asked Heather to send out to everybody, slide 20 shows the exact amount.
Okay. So we'll try to get the amount on the sheet that you get for what 2 would cost and what 5 would cost, right? You have it divided that way, John.
Yeah, you can see we did it for 5, just divided up.
Okay. Okay, so we'll have 2 and you vote your conscience. Okay. All right. Anything else? Any other questions? Oh, thank you so very much. Have a great week.